Start it.
Okay, what's your name?
My name is Muhammad.
Muhammad Saad. So Saad, how are you? Good. Saad, can you tell about your age?
I am 19 years old.
19 years old. Good. About your weight?
My weight is about 48.
48. Good. That's good. So tell me about your problem.
I am feeling from asthma.
Like cough. Yes, yes. Like difficulty in breathing.
Yes, yes.
And
Chest.
tightening of chest. Okay. Don't worry, because actually it is the most chronic common disease in which your airways become more tough and tight, which are responsible to convey your air to the lungs. So when no proper air can convey to your lungs will be erupted. Okay, don't worry. Very low.
Go.
Because it's very important factor to examine before any medical checkup. So open your mouth easily. Please bring camera near the mouth. Good. No error. That's good. Okay. Thank you. Bring camera near again. Open your eyes. That is the patient Xray, chest Xray. You can see that is the right side, that is the left side of the lung. R always indicate the right side of the lungs, and L indicates always left side of the lungs. You can see these white lines, these are the ribs, and you can see that this space is called heart. This space is for heart, and you can see under the heart that is diaphragm space. So you can see a little bit dots between the ribs. It means that the patient has a little bit lung infections. Okay, a little bit lungs infection. Did anyone in your family have this problem? Anyone? Nobody? Okay. Tell me another question. Have you ever felt tired during cough?
Yes.
How many times?
During cough.
Only during cough. Okay, good. Actually, obviously, when your airways become not soft, when they become swollen, it will be difficult to convey your air to the lungs. So when no proper air convey to your lungs, it means that some errors are coming. So you cannot take well breathing. So it's a common problem. Good. Tell me, how long have you had this problem?
2 years.
So okay, I have examined your proper X-ray. So don't worry, you have no particular problem. I have already checked your all previous records. So you have to avoid some things like cold drinks, like smoking, because these are the main factors for problem. Okay. Now you have a little bit lung infection. So I'm going to prescribe some medicines for you. One is high cortisol injection. You may take in the day like 1 or 2 at a time. Okay? Another is you can take a tablet MNTK, montelukast. You can use it. On third, you can also use cerulean syrup. That is also available in pharmacy. Okay? If you feel no proper relief, then you may go for inhaler, like Selmicort, like Foster. Okay? If no relief you can got from inhaler, then you may go for nebulizer machine. So nebulizer, you have to use only 2 solutions. One is cleaning and second is cutter. At the day, 3 times. Okay, tell me about your food.
I usually use street food.
Street food, that's not good. That's not good for your chest because you are coughing patients. You are affected with asthma, so how can you take a street food? It's so bad for your health. Okay? Please avoid it. Avoid from street food and avoid from like smoking and from dust. Always be use mask wearing from outside the city and avoid from going outside like factory areas. Okay? And always be used of fatty fish like berries, etc. Okay. Tell me, do you feel chest pain while coughing?
Yes. Also
Only while you feel coughing.
exercise.
Or exercise. My second question is to you for, can you tell me the working hours of chest pain?
Working
At daytime or night time,
mostly in daytime.
before sleeping, after sleeping,
Yes. Doing exercise also.
after exercise. Can you tell me where you feel the pain in your chest? Can you point out this?
In both parts.
Which part? Can you point out? Like this one, both sides.
Lower.
Like this side and
Yes.
sides. Your chest pain is too much or little when you feel pain? It's so high or low?
Sometimes it become high and
Sometimes
less,
it
it
becomes
become low.
When you take some medicines, then it will become less.
Yes.
Okay, good. Do you feel chest pain as well as wheezing?
Yes.
Sometimes. Does pain radiates to another part of the body, like arms, like chest, like
No.
shoulder?
No.
Not other parts of the body? Okay. Have you had pain previously? In between 2 years?
Slowly it increases.
Slowly it will increase and decrease, up and down with the passage of time. Is it same for last time and that time?
No.
Different.
Different.
You mean to
Now-
say
now
when
it's
you
high.
feel before, that was minimum or high?
Then minimum.
And
Now-
at this time high.
एक मिनट अभी तो भाई मेरे को आवाज नहीं आती
Have you ever used aspirin for chest pain?
No.
No.
अच्छा
That's the main fact because aspirin is a very effective medicine for chest pain. It will relieve your chest pain, okay, and also help any other metabolic problems of your body. Okay, so don't worry. I have also chest examine your chest well. Now I'm going to some medications and comments. Okay. So please listen carefully. Use aspirin because it reduces your pain quickly. Always. You may go for aspirin. I repeat it again. And always cover your chest with normal cloth. Or cloth in summer. Summer or in winter. Okay, my third question to you, Sister. Now at this time, what's your feeling about chest pain? Have you taken any medicine at this time for chest pain?
I don't take it.
Like Panadol, Aspirin, no one medicine. Okay. Auscultation of chest with help of stethoscope. Okay. The method which used with stethoscope is known as auscultation. The method which is used with stethoscope, that is called auscultation. So are you ready?
Sure.
Okay, good. Now I am going to start auscultation process on this heart with the help of stethoscope. So first of all, it is must to know about stethoscope. It is more important factor to know about stethoscopes. Please turn on camera and near back the stethoscope. I will introduce this. You can see here, these are the ear tips. These are the ear tips of the stethoscope, which are used to hear the listening of sounds of lungs and heart and many others. And you can see the silver light tube, that is binaural tube, and that is the simple tube. You can see back of the drum, that area is called bell, and that circle type area is called diaphragm, and that is called drum. Now I am going to examine the chest of this heart with the help of stethoscope. First of all, it is important to check our stethoscope, is it working or not, because sometimes due to the error, some error occurs. First of all, I have to check the right side of the lung. Deep breathing deeply. Good. More deeply. Now on the left side of the heart. No breathe. Stop. Good. Stop. Okay, sir. Now I am going to your practical checkup of your chest. Okay. Please lie down. Good. That is the lungs part. You can see these are the lungs. These are the lung sides of the patient. That is the right side and that is the left side. Always be remember, left side indicate the left side of the lungs and right side indicate the right side of the lungs. Okay. Now we are going to make some lines. You can see these lines. These are called ribs. Okay. Sometimes we see a lot of space in X-ray between this location. That is the heart location. Always be remember that is the heart location of the patient. And you can see this whole space area is diaphragm. That is the diaphragm process. So now that is the first process. There are 3 parts in lungs, 3 lobes in lungs. First begins here from the nipples, that is called upper lobe, and second one is start from the 3 to 4th of the rib, that is called middle lobe, and third one is at the end between 4th to 7th rib, that is called the lower limb. Similarly, on the right side of the lungs, there are three main lobes of the lungs. First is the upper, middle, and third one is the lower. So if we want to judge the sound by stethoscope on the left side of the lung with the help of stethoscope on the middle lobe, then we place our stethoscope on the middle side of the patient. Always remember that is the upper side of the upper lobe of the patient, that is the middle lobe of the patient. So I will place this on the middle lobe of the patient. Take breathing deeply. Now I clearly hear the sound. Stop. If you want to hear the sounds on the lower limb of the patient, then you have to place the stethoscope at this place. Okay. If you want to hear the sound, then you have to place the stethoscope at upper lobe. You can also hear the sounds on the lateral sides of the body, like this, and similarly on the right side of the lungs, that is the upper lobe, that is the middle lobe, and that is the lower lobe. Okay, similar. Turn back, sir. Okay, you can see the back side of the patient. As before, we have examined the first part of the body, and now we are experienced about back side of the patient. You can see here that is the back side of the patient. That is the left side, that is the right side. Similarly, we have already discussed in previous few minutes. That is the right side, that is the left side. Similarly, here is the upper lobe, here is the middle lobe, and here is the lower lobe. Similarly, here is upper, middle, and lower. Always remember, lower lobes are always be located between 3 to 4 lobes. So if you want to hear the sounds with the help of stethoscope, you can hear anybody, like middle part, upper part, and lower part at which place. So now I'm going to examine with the help of stethoscope. You can see.
बस 5 मिनट तक यहाँ से करें।
Take breathing deeply. Good. Stop. That is the middle lobe. Okay. Deep breath. Good. Now I want to examine his chest sound on the lower lobe between 3 to 4 lobes. Good. On middle lobe. Good. Upper lobe. Good. Stop. Okay, good. Come back to hold your position. Okay, sir. Now we are going to discuss about precautions of chest. Okay? Your precautions of chest by hands. Lay down again. Hold straight with your hands. Lay down, relax. Good. That's the main position of the patient, you can see. So now I'm going to precautions of the patient with the help of hand. I'm going to precautions firstly on diaphragmatic place of the patient. This one. Expand. More expand. Expand your chest at which limit you can. Good. Hold back again spread, back, spread. Okay. So now we are going to precautions his interior part of the chest, first part of the chest. Okay. So please bring camera near the chest, interior part of the body. That is the upper lobe. Okay. So now I'm going to precautions with the help of my finger. You can see the sounds of chest. You can also check on the lateral sides of the chest also. Okay, good. Hold your position. Hold your position back. Come back. Good. Our precaution is also complete. Now I'm going to discuss some respiratory problems, which may also always have to lead asthma, like chronic bronchitis and so many diseases. So it is must necessary for the patients to avoid drinking, smoking from outside where he get this mud and smoking. So I recommend you that sir, tell me one more thing. Do you have any animals at your home?
Yes.
No, that's quite wrong. Okay, that's quite wrong because these are the main factors for coughing. Okay, good. So now I'm going to discuss your medical checkup with my experts about your chest pain and about your precautions and about your subjective examination. After this, we will call you again and tell you about more tests which you have needed. Okay? Good. Nice to meet you. Thank you for coming. See you.